is Jacinta Birungi. I'm a nursing officer from Zambia Cancer Center. Today we are going to talk about the cancer and breast cancer in particular, because this is a breast awareness month. October being a breast awareness month, we need to express our views on and awareness about breast cancer. What is cancer? Cancer, many people when they hear about it, they get scared and they even don't want to listen to anything connected to it. But we must say it is living with us. Cancer is when our body cells begin to grow uncontrollably or abnormally. And when they grow abnormally, they begin forming swellings in some cancers. In some, they don't. But to be in particular, the blood cancers, they only take the blood cells. But in other organs, they only grow and they become swellings, which we call lumps and tumors in the end. So for the breast, we are going to talk about that lump or the swelling that comes in the breast, and we have diagnosed and call it breast cancer. I will begin with the causes and risk factors. The risk factors, the major risk factor is the family history. If you have a close relative, a sister, a brother, a mother, a father who has cancer, or particularly the breast cancer, you will also be prone to it. So in case you are in that family, please take note. Another risk factor is obesity. If you are fat or if you are overweight, that is also a risk factor. Another one is age. If you reach the age of 40 upwards, you are beginning to have body changes. So that is also a risk factor. But most specific is on the menopause time. So you need to be also sure that you must know that you are at risk. Another one is reproductive factors. These ones usually come in the time that we are beginning to grow as women, right away from the time one has the first time that she got her periods, because that is when we begin producing estrogen hormone. And the estrogen hormones, once they are raised in your body, they cause breast cancer. Menopause, we said already, it is part of it. Age at first pregnancy also matters. That is from 38 above. That is when you get the first pregnancy, also matters. Also, if you breastfeed less than 2 years, you have to breastfeed your baby at least more, or at least 2 years. Another one is if you don't have any child, meaning that you have not breastfed. Breastfeeding reduces the risk, but if you've not had any child, you've not breastfed. So meaning that you are also prone. I want us also to look at the way we are living. There's alcohol and tobacco use. Any kind of alcohol or any kind of tobacco, whether it is chewed or just sniffing or whatever stuff it is, as long as it is tobacco, when you use it, you are at risk. Let's see on signs of breast cancer. There are many signs that make our breasts change and we get scared. But to be very specific, the breast cancer comes with a swelling in your breast. If your breast has a nipple which is inverted, maybe there is a swelling inside. So there is also a chance for you to have being checked before it becomes bad. Also, look at your size of the breasts. If the size of the breasts, there is one which is much, much bigger than the other. Though normally in women, one breast could be bigger than the other, but If it is extraordinarily bigger than the other, then there is cause of alarm. Check your breasts or take them to the person who can really help you and find the cause of that. We look at the skin of the breast. If the skin changes like to become scaly or shiny, looking like exactly like an orange skin, that is a worry. If you know an orange, the way it looks like, and it is on your breast, then there is also a cause for you to go and be checked. In your nipples, usually there could be a discharge. Normal discharges, we don't mind, but the abnormal one is the bloody one, or the brown, bloody like discharge. So those symptoms, usually we monitor them accordingly, and then we have to screen you seriously on that once you see them. Prevention. And how do we reduce the risk of getting breast cancer? I talked about the family history. Once you have a family history, go and be checked, no matter what age you are and what gender, because even men can get cancer. So no matter what age and what gender, go for screening. And when you are screening, you have to give out your history openly to the clinical person so that they can do the best out of it. You can also reduce the risk by avoiding alcohol and tobacco use. You can reduce actually alcohol because they say some amount, though it is not estimated, depending on what you take. Then you can do a monthly self-breast check. You are the first doctor of yourself because you know your body, you know how you grew, you know how it is. Once you identify the abnormalities I have talked about, you can easily go to the medical personnel so that they can identify the problem and then manage accordingly. So if we check you and find out that you have a problem, there are many ways that we do manage cancer. It doesn't mean that is the end. If you check early, we can get the problem early, and the treatment is actually good. We treat for cure. That is if cancer is got early. But if you delay to check, then the outcome will not be good because it will invade other areas of which you cannot treat. So we do the clinical breast check for those who are screening the breast. We do breast ultrasound, do mammogram, and once there are abnormalities in those, we push you to other things that diagnose. Say like taking off a tissue so that we can examine and see and confirm if you have cancer. At Zambia Hospital Cancer Center, we do all those tests. You're most welcome. Thank you.